Day Live, we continue this week with our discussion of fentanyl and the crisis that's facing our country. We aired a special on Monday for the Wabash Valley, and each day this week we're so glad to welcome those in our community who will know what it means to fight it here locally. And we've got some very special information today. Chantel, thank you for being here.
No problem.
Sycamore Pain and Wellness is where you call home.
Correct.
And can you describe to people what your job is when it comes to the medical side of treating those who may be battling an addiction?
So I'm a nurse practitioner at Sycamore Pain and Wellness, and what I do is patients will often come to me seeking help because sometimes when they've gone through their journey of sobriety, they may need a little bit more assistance, and we provide what's called medication-assisted treatment by prescribing different medications, something called like buprenorphine or Vivitrol. And what that does is that helps patients to be able to not have those withdrawal symptoms or experience those cravings where they constantly want to seek something maybe out on the street that will hinder their sobriety and their journey back to kind of a normal life.
You know, we talk about fentanyl, and what we learned in that special is sometimes an addiction starts when you've never even really tried any, whether it be illegal drugs or prescription drugs, and then you have an accident or something goes wrong. How often do you see that happen?
Actually, the majority of my patients that I treat were prescribed appropriate medications for something like a fracture or a surgical procedure. We also see where they were prescribed medications for dental procedures or following childbirth. Not necessarily that they did anything wrong, but we cannot tell by looking at somebody that they're going to get a dopamine rush when they get that medication. And so what happens is these people get this extra dopamine, that is their reward pathway. So that then tells them, I need to go out and find this. And so when we had that CDC guideline released that then turned and had all these prescribers telling us to reduce the amount of opioids we were prescribing, a lot of prescribers suddenly just stopped cold turkey, which left a lot of patients kind of high and dry, and they were not appropriately weaned off the medication. So when that happened, people experienced withdrawal symptoms, which is horrible. It is nausea, vomiting, diarrhea, cold chills. They can't function. They can't go to work. They can't take care of their kids. And so then they were left trying to find something to help them get back to that normal, to be able to function in their normal life. Yeah. So then that's when they turned to finding opioids on the street, and then when opioids became too expensive, then they turned to heroin. And now what we're seeing is a lot of heroin or other substances that are being sought out is being laced with fentanyl.
You know, it's a scary thing as we talk to the police and we talk to those with Vigo County, drug-free Vigo County. We learned that we're not so bad in this area when we look at the rest of the country, statistically speaking.
Right.
But we hear what you say and we realize there may be people out there that just don't even know where to go to seek this kind of help.
Correct. And so sometimes patients aren't aware of the resources available to them, and so that's why there's a big push in the community. We did a Narcan Day yesterday where we're trying to get the information out there with resources. There's tons of wonderful resources out there. Places like Anna Branch, Next Step, Wabash Valley Recovery Center is an amazing resource. They help patients with peer recovery support. They get them transportation to their visits. They even help them try to get a job, because a lot of times these patients are finding it very difficult to get a job once they are on the road to recovery.
How blessed we are in this community to have the resources we do, so that if this gets here on that delayed incoming problem in our area, because they say sometimes we see it years later in the Midwest, we've already educated ourselves so much. We've already created a support system, and at Sycamore Pain and Wellness, you all are doing what you can to prevent it from getting any worse.
Yes.
Wow.
Yes.
If people are watching right now and they have questions, we've put a website on the screen, myhorizonhealth.org/MAT. Where does that take them, and what information will they get from that?
So what that will do is take them to our website, and that will give them information regarding the treatment that we provide. We also have excellent resources within our own office for therapy as well to go along with that, because that's a big component of the medication-assisted treatment, is combining that with therapy and making sure patients have all the coping skills. So that will give them the number to contact our office and be able to schedule an appointment with us so we can get them the help that they need.
And that number is right there on the screen as well at 812-877-3310. They're located on State Road 46, Sycamore Pain and Wellness, part of the Horizon Health Group, and myhorizonhealth.org is the website once again to go to for more questions. You get to serve in a unique way with what you do, and I think that's very special, to be honest. I can't think of another word, because what you're doing is helping people understand what they have is treatable, curable, and they can live.
Yeah,
right?
I have a couple patients that I have seen through the whole kind of journey, and they came to me seeking treatment, and now I get to see them thrive. I mean, just because they had this one issue in their time of life does not mean that they don't deserve a good life. Now I see patients who are able to go back to school and become a peer recovery support for others that need help, and they kind of get to pay it forward now.
Well, what you're doing is incredible work. So once again, if you have questions, if you're looking for information, if you're seeking that medication-assisted treatment, you can contact the number on the screen or visit myhorizonhealth.org. And another resource we want to mention is overdoselifeline.org. Very helpful on multiple options for naloxone availability throughout the state of Indiana. Free nalox boxes, vending machines, fentanyl test strips, and more. You can find, based on where you are, where to find these items that could be life-saving. Overdoselifeline.org. Search in your community. And stay with us. We'll be back.